How does robotic surgery affect swallowing after sleep apnea treatment? Have you ever wondered how advanced technology like robotic surgery can impact something as essential as swallowing after sleep apnea treatment? Let's break it down in a straightforward way. Robotic surgery, particularly transoral robotic surgery, is becoming a popular option for treating sleep apnea. This technique focuses on reducing tissue at the base of the tongue and other areas that obstruct the airway. By reshaping or removing this tissue, the goal is to improve airflow and reduce the number of apnea events during sleep. Now, when it comes to swallowing after this type of surgery, the effects can differ in the short term and long term. In the short term, most patients find that they have minimal swallowing difficulties right after the procedure. Typically, patients can start eating again within 1 to 3 days after surgery. Serious issues, like needing feeding tubes, are quite rare. While some patients might show signs of aspiration on imaging studies shortly after the surgery, this is not common and usually resolves itself without causing lasting problems. Overall, most people recover their swallowing abilities quickly without any long-term issues. However, the long-term effects can be a bit different. Some studies suggest that reducing tissue at the base of the tongue through robotic surgery may lead to challenges with swallowing later on. Patients might notice symptoms like food residue in the vallecula, which is the space behind the tongue, or early spillage of food or liquid during swallowing. To identify these potential issues, doctors often use objective swallowing tests and patient self-assessment questionnaires. The extent of tissue removal and individual patient factors play a role in how swallowing is affected over time. It is essential for healthcare providers to carefully select patients for this surgery and provide thorough counseling before the procedure. Post-operative monitoring is also critical to manage any swallowing concerns that may arise. In summary, while robotic surgery for sleep apnea generally has a good safety profile regarding swallowing, some patients may experience mild to moderate changes in their swallowing abilities in the long run. These effects are usually manageable and should be weighed against the benefits of improved airway function and better sleep quality. Clinicians are dedicated to evaluating and following up with patients to ensure the best possible outcomes and address any swallowing issues after surgery.